Hey everyone, welcome to my channel. I've noticed that there are a lot of people out there who are feeling like maybe they need some help and are wondering if going to the ER would be the right thing to do for them. So if your safety and well-being is at risk, it is absolutely the right thing to do. I'm going to walk you through what happens from the time you get to the emergency department until you're either admitted or discharged from the emergency department. So once you decide that you're at that point, that for your safety or the safety of those of others, you need to be seen by a psychiatrist at a hospital, and you end up going willingly, which means the police were not called and you were not detained under the Mental Health Act and taken to the hospital. Then when you get there, you'll see a triage nurse. So I'm going to talk about Lakeridge Health Oshawa, as this is not only my local hospital, but it's the one that I've been to the most over the years. So I would go in, and now they have you pick a number and wait to be seen by the triage nurse. There they will ask what brings you into the emergency department. I usually tell them that I need to see the crisis intervention team. The triage nurse will ask you a few more questions. If you've done anything to harm yourself, maybe allergies, as well as take your blood pressure and temperature. They'll ask you to sit in the waiting room to be registered. So you go, you do that. So when you hear your name being called on the loudspeaker overhead, the nurse there, whatever desk you have to go sit at, she'll confirm your address, your doctor, again, your allergies, and give you a bracelet. If you have allergies, you're going to have a different color on your bracelet, I believe. I don't have any allergies, so it's not something that I worry about, or they worry about for me, I guess. So now you're admitted to the emergency department, and you're a patient once you have your bracelet. You will then be asked to wait to see the medical doctor for medical clearance. This can take a long time to happen, as you're not in an acute emergency. You're not bleeding out. You're not dying. So I've had very different experiences with the medical doctors in the emergency department. Some just ask a couple of questions. Have you done anything? Do you have a plan? But some ask more and do more of a thorough history. I think it depends on who the doctor is, how busy they are, a lot of factors. So some can be very nice, and others don't seem to believe in mental illness, as they treat some patients pretty crappy. People who are part of the so-called revolving door system, or those who have trauma symptoms, seem to get treated the worst, at least from my experiences. If the doctor doesn't want to take the chance and is worried that you might take off and attempt to bring harm to yourself or someone else, they'll place you on what's called a Form 1. This allows the doctor to hold you against your will at the hospital for up to 72 hours. So up to, not you're going to be guaranteed that you're there for 3 days, but that you'll be up to 72 hours. If they place you on a Form 1, they must give you a Form 42 to make the Form 1 valid and legal. All this shows is that they're keeping you because you're a threat to yourself or others, and that you need help, and that you've been made aware of this. At Lakeridge Health Oshawa, from my experience, the security and or nurses will then make you change into hospital gowns and, a hospital pair of pants if they have them. Your clothing and belongings will then go to security to be locked up. Sometimes I don't know the protocol exactly. I tend to get one because when I'm not doing well, I don't tend to stay put very well. So I tend to get a one-on-one with security, or I have security watching me. So that might be something that happens depending if they're worried that you're going to take off or not. Then you'll see the crisis intervention team member. This person is a person who conducts a mental exam on you, takes a history to figure out what brings you there and what you're needing to be done while at the hospital. Kind of like, why did you come to the hospital? Now, these days, I've had very mixed reviews from Lakeridge Health. I haven't been myself in a long time, but I have accompanied a number of friends there, and I've not really liked what I've witnessed. However, if it's your first time there, they do tend to be more cautious with what they do to you. The people that I've been accompanying are part of the revolving door, which means they've been a number of times. Makes sense. So if after the assessment is over and the crisis intervention team member believes that you would benefit from seeing the psychiatrist, then you will wait and see them. Often, this is a really long wait. It can take hours. I waited 5-6 hours. And at Lakeridge Health, Oshawa, there's no psychiatrist overnight. So if you go in past 11 o'clock, I think it's 11 o'clock at night, you'll be staying until morning. If you're on a Form 1, they'll put you on a cot in the emergency department. So after you wait to see the psychiatrist, you'll go over many of the same things again with the psychiatrist, the reason you came in, your plan, etc. The psychiatrist will try and see if you have anyone who you could stay with or could stay with you or any other options so that they don't have to admit you. If they do feel it's best, they will bring you into hospital. These days, this means that you'll go to the MISU, which I'm not entirely sure what that means. I can't remember what it stands for. But it's a small 8 to 10 bed unit. Doesn't have any windows. It's not very nice. Last I heard, it didn't even have a shower, which is kind of gross. When a bed becomes available on the mental health ward, they will transfer you up. When you're on the MISU, you will see a psychiatrist daily, and if you're better, they may even discharge you from there without even going to the ward, which actually happens quite a bit. The people that I've accompanied there haven't even made it to the ward. They've been discharged right from there. But they are the revolving door kind of clients, so they're more likely to be discharged quicker as well than first-time clients or patients. So I hope this helps you understand the process of what happens when you need to go to the emergency department because you're feeling unsafe. I'm going to talk about what it is like on the inpatient ward and that process in another video. Click above to see that video. Make sure if you liked the video that you hit subscribe and ring the bell so that you know when I update more content. Be safe and respect yourself. Take care.